What's up YouTube, it's your boy Darius back again with another video. Today's video I'm going to talk about what it's like or what it has been like for me to be an ICU nurse and working with MedSurg patients. So before I get into today's video, I just want to say thanks again to you guys for watching, subscribing. Make sure you guys continue to subscribe. If you're not, you can hit the notification bell to see whenever I post a video. But other than that, being in ICU, as you know, if you're not familiar with what it's like to work in the intensive care unit, also known as ICU, basically you have 1 to 2 patients and they're hooked up to monitors all the time, constantly being monitored. You're kind of always in the room doing things. And then so there's different levels of care, with ICU being like the most intense level, right? So I have been floated, or I've been floated to MedSurg units, or I have had MedSurg patients in the ICU as like an overflow. And just so the MedSurg, if you don't know, those patients are the least sick, right? So you have like MedSurg, telemetry, and then you have like ICU. So those patients are the least sick, so they're typically have vital signs every 8 hours, which means the nurses, they usually, they do one set of vital signs in their shifts, and they kind of go and check on them whenever they have meds, basically. So they're not as frequently checked. A lot of patients in the MedSurg unit have like their own rooms, and their doors will be closed. It's a little privacy. Patients like that, they enjoy that. So the issue that I have with that is, and what's weird to me is, I understand that those patients are at least at risk for something to go wrong. So that's why they're not hooked up to monitors. That's why they have vital signs every so often. But you do get cases, and I feel like it might be more often than not, or than should be, where a patient, let's say a nurse is doing his or her rounds, and they go check on their patient, and they walk into the room and the patient is no longer breathing. Okay, so they call code blue, and then the problem that I'm finding obviously is we get there and we ask, okay, what happened? How long have they not been breathing? And a majority of the time the answer would be, I'm not sure. And the reason why the nurse might not be sure is because, and it's not the nurse's fault. It's just kind of the way it's set up. The reason why that happens is because when your patient is not being monitored frequently, or doesn't have a EKG monitor on them, or any type of monitoring, things can happen. And then so let's say you have medication pass at 4 a.m. and it's only 12, and you don't have to go check on them. You're not going to check on them for 4 hours typically, right? So you don't, between that 4-hour window and sometimes longer, you have no idea what happened leading up to the event of them not breathing. And then so that's, and I don't think it's going to change. Obviously it's probably a very big cost effective measure, like if facilities have to start buying a whole bunch of equipment to monitor the patients, they're probably gonna have a problem with that. Patient's gonna have a problem with being monitored. But to me, it just comes down to a safety thing. Like, it doesn't have to be as intense as being hooked up to everything, like in the ICU. Or it could literally be something as simple as, hey, check on your patient every 1 to 2 hours, It's just something that actually always bothered me, is that you don't know what happens when you're not checking your patients frequently. And again, that's kind of how most facilities are set up on the MedSurg units. I don't like that you do vital signs once a shift. At least, how about at least every 4 hours? It's not very difficult. So overall though, working with MedSurg patients, I don't dislike it. For me, it's fairly simple. It's like I have, I would only have like 4 patients. I've had 5 before, which I don't enjoy, so props to you guys have to deal with that. But for the most part, is you don't have to get as in depth. Some people, I've asked nurses, I'm like, hey, how do you do this and that? And a lot of them say, oh yeah, we just do focused assessments. They don't really do a head to toe. So if you come in with abdominal issues, they kind of just focus in that region. So they have shorter assessments, shorter report. We basically do med passes, vital signs. Sometimes the nursing aides, actually majority of the time, the nursing aides do the vital signs, so the nurse doesn't even have to. And they go about their day, and then they just repeat whatever meds are coming back up, or if the patients, if they're call outs, of course, then they can go respond to that. But I'm not, just so I don't want people to get all angry and stuff, because obviously there's different levels of care and stuff. I'm not a huge fan of MedSurg either, so once again, props to the people who deal with that, just because a lot of people can become very needy, and I do not do well with patients who want me to get them water and snacks and want to complain about every little thing. I don't do well with that. I'm there to take care of the people that are like super sick on their deathbed and try to bring them back. That's kind of like my realm of things. That's what I prefer anyway. So I don't want you guys to, any of you guys who are med-surg nurses are going to be, don't take it the wrong way at all. Not looking down on anyone. These are just my opinions on how I feel, how things are, and how I think they could and should be improved. Just monitor or check up on them more frequently, just from a safety standpoint. But I didn't think that doing the med-surg nursing or patients was very difficult. It was just, like I said, you do the meds, you do your focused assessments, and of course it's different everywhere. I'm sure at some facilities it's more involved. Just for the facilities that I worked at personally, it was not that involved. Very, very simple. But at the same time, it was kind of nice when it comes to a charting standpoint. For me personally, it was like I would just chart one full assessment and be done, and that was great. In ICU, I would do every 4 hours full assessments. And as you know, guys, charting, my opinion, is the worst part of nursing. If we could simply just take care of the patients and that be it, that would be amazing. But of course, what do they say? If you didn't chart it, you didn't do it. So that was great. So there are obviously some benefits, pluses and minuses, to working on a MedSurg unit with MedSurg patients. But other than that, I just want to give you my perspective on working ICU to working with patients who are not as sick or critical. For me, or if you're in ICU and you have MedSurg patients, it's kind of like a nice little break. You don't have to worry as much. You don't have to be really as hands-on or detailed. But I still like to be I keep my patients on their EKGs, blood pressure, but I run it every 4 hours rather than disconnect them and take one set. I'm not doing that at all. I'm not comfortable with doing that. So if they're my patient, they're MedSurg, great. I'm gonna run you every 4 rather than every hour. But it's it's a whole thing in itself. Like I said, different levels of care. But just a super short, quick video. My thoughts of what it's like working on a med-surgical unit. If you saw previously, I had my thoughts on working on a telemetry unit. That was a whole nother beast in itself. That definitely my least favorite that I've done so far. So once again, like I said in the previous video, props to you guys out there who work telemetry. That is a very stressful job. But once again, thank you guys so much for watching, and I'll see you guys next time.